Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
All right, good afternoon, everybody. We're here in the office of PECARN Pediatrics. This is Heather, my medical assistant. She's a big member of the PECARN family, and so any of our patients know what a valuable and great asset she is. Today, we're going to talk a little bit about, I think, a common problem and common concern for our patients, which is head injuries in children. Concern when your child has a head injury and if they need to go to the emergency room, kind of what you could expect. And then we'll talk about some common cases that we've seen.
Mm-hmm. So Dr. Blair, what are some of the reasons that you would send our patients to the emergency room?
So this is a great question. And I think when you're thinking about children who fall and have bumps on their head, you have to split this decision-making in your head into two categories. And the reason I say that is because there is a large network in pediatric medicine. It's called the PECARN Research Network. That stands for the Pediatric Emergency Medicine Care and Research Network. And what they did was a really well-designed, robust study looking at children who have blunt head trauma, which means they kind of fell and hit their head or they were hit by something. And they looked at what are the important decision factors for deciding whether a child has a clinically significant brain injury, which would be something like a brain bleed or a subdural hematoma. The reason why this study was so important, other than the fact that it was really well done and really well designed, is that they found that using this criteria, the negative predictive value or the chance of a child having a brain bleed if all of these decision-making tools are met is almost zero. So they almost had 100% they did have a 100% negative predictive value with really great confidence interval margins greater than 99%. And so it was just kind of one of these studies in pediatrics that really changed or helped guide us on a higher level. And so they kind of split those categories into the under 2 and greater than 2-year-old categories. So the first question I was asking is, how old is the child? The second question I'm usually asking is, have they had any changes in their mental status, like seizures, loss of consciousness, acting differently, not eating, literally anything. Is anything different about them at all? Then I want to know if they have a bump or swelling on their head. Children are very top heavy, so they tend to bump the front of their head, which luckily is the strongest part of our skull. So we know fronts, kind of hematomas and bumps in this area are less risky than if you have bumps on the side of the back or the back of your head, which is called the parietal temporal area or occipital area, those three areas. How did it happen, right? In that age range, severe mechanism of injury is anything from a fall greater than 3 feet, if they were struck by anything, if they fell off a bike, if they were hit by a car, all of those kind of mechanisms are severe. And you're kind of taking the whole picture into account. So I kind of ask these questions and I decide if the answer is no, maybe that's a child who I'm just going to see in the office and not send right off to the emergency room. And the other kind of special population here, I would say, is children less than 3 months old. So really small babies have really soft skulls. And so any child who falls from any distance and is less than 3 months old really needs to be evaluated probably in an emergency medicine situation, an emergency room situation. And the reason for that is because, again, their skulls are so soft, they're just at higher risk for clinically significant traumatic brain injuries. So I think to kind of go back, when we were talking about there might be some kids that call and you say, hey, Dr. Blair, then, this family called and they've got a bump on the head in the front of the head and they fell while they're running down the sidewalk. And I say, okay, let's bring them into the office instead of the emergency room, depending on kind of how they answer the questions. What I'm going to be looking for is the same thing. I'm going to be feeling the front of their head and seeing if I feel a skull fracture. Because if I do feel one, even though the front of their head is kind of thicker like we were talking about, I'll be sending them to the emergency room. And once you get there, you're going to find that the emergency room doctor is likely going to ask all the same questions I just asked and do a complete physical exam. They're also going to be checking their vital signs. And then they're going to start thinking about whether they think there's a risk for a clinically significant traumatic brain injury. And that's really going to be something like a subdural hematoma or a brain bleed. And looking for blood in the brain, there's really only two options. You can do a CAT scan or you can do an MRI. Unfortunately, x-rays will show skull fractures, but they're not going to show if there's blood in the brain. And And the reason that we don't just send everybody through a CAT scan or an MRI is twofold. One, with CAT scans, there's a risk of ionized radiation. And what we're really worried about with ionized radiation is what is the risk to the child of potentially having, later on in life, getting a life-threatening malignancy or cancer. And we know that the risk is higher likely for smaller children than it is for adults. So we want to make that decision about whether or not we're going to get a CAT scan really carefully and really carefully balance the risk against the harm. Most places are not going to do an MRI for this kind of case for two reasons. One, an MRI takes much longer. So if you have a child that you're concerned has bleeding in their brain, you don't want them sitting in an imaging machine for 45 minutes because they could potentially decompensate and you're not able to really directly observe them very well. And two, small children often need to be sedated for MRIs, which is also not a great choice when you are considering a brain bleed as a possible diagnosis. So they are likely going to either, talk to the family and discuss potentially if they think a CAT scan is warranted, or they might do something like observation. So sometimes, depending on the answers to the question in the individual case, the ER physician might recommend observing your child for 4 to 6 hours in the emergency room. And they're really looking for any signs and symptoms of a brain bleed, which would be changes in mental status, like changes in behavior, or, a level of awakeness or alertness, changes in vital signs, things like that. And we know that if you have a clinically significant brain bleed, you're going to have symptoms likely in that time range. And so that's why we choose the 4 to 6 hours as opposed to observing somebody for 24 hours, let's say.
Dr. Blair, you talked a lot about children that were 2 years and under. What would you do if we had a patient that was in preteen, teenage years?
That's also a great question. So I think in the beginning I kind of talked about how PECARN separated the less than 2-year-olds from the greater than 2-year-olds. So the risk factors are different. So if you're greater than 2, things that you're kind of looking for, questions I'm going to ask are, do you see any swelling, bruising behind the ears? Again, do they have a bump anywhere on their head? And these older children and the younger children, so for both categories, loss of consciousness. And we're talking about not brief loss of consciousness, but loss of consciousness for more than 5 minutes, like they were out cold for 5 minutes. In both categories, abnormal body movements like seizures, that would kind of fall into that change in mental status that we were talking about. So in the older than 2-year-old age range, the mechanism that we consider severe is also different because they're bigger and their brains and skulls are a little thicker. Instead of 3 feet, greater than 5 feet is concerning. Still kind of falls like from a bike where they were hit by a car, if they fell off a car, a high moving vehicle, and a large height are all going to be concerning. Another concerning and often common question I find is vomiting. So if they vomited once, that's actually not considered very risky, but repetitive vomiting, so vomiting really more than twice. Sometimes I have patients say they vomited twice, but it was kind of more back-to-back vomiting, like they took a deep breath and they vomited again. I would say that's really one episode of vomiting, but if you have like a good amount of time between those episodes and they vomited twice, they're going straight to the emergency room. And then severe headaches. These kids are old enough to tell us that their head really hurts. Blood in your brain is very irritating. It causes one of the worst headaches anyone's ever felt in their life. So if a kid is telling me like their head really hurts, I'm also sending them to the emergency room.
So, Dr. Blair, I have a few cases that I want to talk to you about and see what you would do in those cases.
Great.
First would be a toddler. Let's say the toddler is in the mother's hands. Mother's walking down the steps, accidentally falls.
Happens all the time, right? Especially, I think parents were exhausted. We're carrying our babies all the time. You trip over a stair and you fall. I guess my first question for you would be, how old is your child?
Child is 2 years old.
Okay. So we can kind of walk through our decision-making algorithm. So for a 2-year-old child that fell down the steps, I would ask, how many steps did you fall down?
7.
Okay. And does your child have any bumps or bruises on their head?
Nope.
And how are they acting?
Acting normal. Just crying.
And when did this happen?
30 minutes ago.
Okay. And did they, at any point when they fell, did they kind of immediately cry, or was there a point where they were super sleepy, not waking up?
No, they cried right away.
Okay. And right now, do you feel any kind of swelling anywhere on their head?
Not that I can feel.
All right. So in this case, because your child is a little bit older and they're acting normally and you fell downstairs, it wasn't a direct fall from, like, let's say you fell over a balcony or something super scary. I would recommend that we kind of watch your kid for a little bit. The risk factors here really are that you add your weight to your child's weight when you fell. But we know that falling downstairs are less risky than, like I said, a straight height of, let's say, 3 or 4 foot drop. And your child doesn't have any swelling and they're acting normally. But if they develop any swelling on their head or they start acting normally in any way, I'd either want you to call me back or go to the emergency room.
Great.
And I would say if this same case presented to the office and your child was younger, like less than 3 months old, like a newborn, even if they had no bumps on their head and they were acting normally, that's a child who should be seen by an emergency medicine physician.
Okay. So the next patient I want to ask Dr. Blair is the patient's mother just called our office. Patient is 5 years old. They were at the park and they were running and they just tripped and fell.
All right. And so do they have any kind of bumps and bruises on their head anywhere?
There is a minor bump on the forehead.
Yeah, big egg on the forehead, right? So it's kind of classic with those, especially the younger kids, like the toddlers who are still getting their feet underneath them and they're running at full speed as fast as they can and they trip and fall. And it's always on the sidewalk, right, or at the playground or somewhere hard and they get a huge egg on their forehead. So for this child who's 5 years old and they have a big egg on their forehead, my first question would be, where's the swelling?
The swelling is on the right forehead, right frontal lobe?
Kind of like the front part or the side or the back?
Right on the front.
Okay. And are they acting normally? Have they had any changes in their behavior at all?
They're crying a little bit, just very sad, closed, not happy to be at the park anymore.
And did they lose consciousness at all, or did they kind of immediately cry when they fell?
They immediately cried.
So I'd say for this child who, fell from standing, doesn't have any swelling on the side or the backs of the head, is acting normally, and didn't lose consciousness, this is probably a child who I would say, again, let's kind of watch and wait. As long as they don't develop any severe headaches, vomiting, changes in their mental status, I think this is a child who could stay at home.
Okay. So the next patient I want to present is a 12-year-old male. He was on the back of a moving truck and hit the back of his head.
Okay, the vehicle was moving when he fell out of it?
The vehicle was moving. The parent didn't know that the patient was on the back, and he fell back off the bed of a truck and hit the back of his head.
Okay, and how old is this child?
12.
Okay, and when they were in the back of the truck, about how high would you say the back of the truck is from the ground?
I would say about a foot.
Okay, and how are they acting now?
They passed out for a couple seconds.
Okay.
There was bleeding in the ears.
Okay. Any swelling anywhere else?
Swelling in the back of the head.
Okay. So this child right away, based off of talking to you, I would say as soon as you get that call that a child fell from a moving object, especially a truck or a moving car or vehicle, that's a severe mechanism of injury, and that child's going to the emergency room right away. Some of the other kind of red flags that you raised in this case are that, well, A, the mechanism of injury, of course, right? Mm-hmm. B, the bleeding in the ears is a really concerning sign. So the base of your skull ends right behind your ears. And sometimes when you have something called a basilar skull fracture or a fracture of that bone, it can actually present with bleeding behind the eardrum. And in some cases, there's a traumatic rupture of the eardrum. And that's when you actually see the blood come out of the ears. So that's a really concerning sign. And then the third thing that you brought up that is concerning is the swelling on the back of the head. So in the occipital region or the parietal regions, which are here, are much more concerning than the front of the head. And then the last thing that you talked about was he lost consciousness. So he did lose consciousness. It seemed like it was likely less than 5 minutes, but with all of the other information that you presented, this is a kid I would say, please send them to the emergency room right away. And it's probably a child I would expect when they got to the emergency room that they were likely going to need a CAT scan of the head. And so this is kind of the child that I would be saying to the parents, up front, I'd be talking to them about the fact that they likely will need a CAT scan, and what are some of the risks of the CAT scan, and why do I think maybe the risks are outweighed in this case by the risk of a clinically significant traumatic brain injury.
So Dr. Blevin, the last patient I want to present is a 9-year-old football player, male, and he just got an injury playing football.
Yeah, so this also happens not just in football, but soccer, lacrosse, right? They have a young kid and they just get slammed in the head or totally knocked out. So in this case, you have asked my first question, which is how old they are. They're 9. So my second question is always going to be, did they lose consciousness?
They did not.
Okay, great. And do they have any kind of swelling, any bumps or bruises on their head?
No bumps.
Okay, and how are they acting? They've been acting normally?
They feel nauseous.
Okay.
They're complaining of nausea and dizziness.
Has he vomited at all?
No vomiting.
So in this child, this is probably somebody where I would be concerned that there is likely going to, that there's risk for concussion, but maybe not a risk for clinically significant traumatic brain injury such as a brain bleed. So I probably wouldn't send them straight off to the emergency room for a CAT scan, but I would recommend that we see them in the office and screen them for concussion and kind of their whole return to play protocol, which we can talk about in another episode. Cool. But as long as they didn't lose consciousness and they're acting normally, just getting hit in the head playing sports is not considered a severe mechanism. And so while they're at risk for concussion, they're not necessarily at risk for traumatic brain bleed.
Okay. One last patient that I want to discuss. Patient just called. It's 4:30 in the afternoon. Patient is a 6-month-old female. She fell off the couch yesterday morning.
So this is a great case because here we have a child who fell off a couch, right? But it's been potentially a long time. So I still ask all the same questions. First, the age. Second, how high was the couch?
The couch, I would say, between 10 to 12 inches off the floor.
Okay, so not a severe necessarily mechanism of injury. And does the child have any swelling around their head?
There is a bump on the front of the forehead.
Okay, and have they been acting normally?
They've been sleeping a little bit more.
Yeah, so this is great because, right, it's always that they've been sleeping a little more or they seem a little bit more fussy. But my thought process in this case would be it's been over 24 hours from the injury. And so if there was a clinically significant brain bleed at this time, during this time frame, the child would have either been past the time where we would recommend observation or we would have gotten a CAT scan. And I would expect them to have much more significant symptoms if it was a clinically significant traumatic brain injury. And so for this child, because if they had presented yesterday morning and they were acting a little funny, even though they didn't have a severe mechanism and even though the bump was on the front of the head, I would probably say because they're acting funny, they should go to the emergency room. But now that it's been more than 24 hours, the risk is so low that I would probably say we can continue to watch this at home. And I just think that this is something that happens all the time. But at this point, again, the time frame from the injury is so long that if there was a really significant brain bleed, they would be much more symptomatic at this point.
Okay.
And I think that it's important to kind of take all of this information with a grain of salt because at the end of the day, none of these rules are hard and fast. They're decision-making helpers, but not black and white rules. There's a lot of gray in there. And so it really depends on the physician's level of comfort, the parental concerns, and each individual case. And I think you have to take each individual case as it is and make a decision for every child differently than you would apply one of these cases to every single kid. And so I just want to put that out there because I think that, again, this is an area where there's a lot of gray and physician experience and the kind of nuances of the physical exam and presentation are important.
Great.
So I hope this was really helpful to all the parents and patients out there. I think it's a common area of concern, and I definitely think it's a decision when you're thinking about, exposing your child to ionized radiation. It's not made lightly, and I hope that if you guys have any questions or concerns, of course, please leave them in the comments. We're always happy to hear from you guys.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.